Hi, it's Dr. Jeff Pierce from Michigan Sports and Spine, and we are here in December with fighting the cold. The weather's holding up. A lot of COVID questions, a lot of excitement. I'm actually very excited today because one of my best partners in crime, Dhana, Ponners, is going back to my radio show days on 97.1 The Ticket. We spent almost 2 years on the show answering questions in our 1 hour radio show on Sunday mornings. So she's finally making an appearance after our episode 30 here. She's our episode 31. So get your questions out. I mean, she's probably, I would say, one of the best therapists in the city. We have great therapists here, but she's a very important person. So we're very honored she's going to be coming on. So we're going to talk a lot about physical therapy. We're going to talk a lot about what I've said before in the past, that not all therapists are created equal. Why is that true? We'll get into the training. We'll get into the reasoning. We'll get into how we actually handle cases. Like I just had a very difficult case right before the show that has a 10-year problem, and he's been going to some other colleagues in the area that I feel maybe missed the diagnosis and the real cause of his discomfort. He's had injections, he's had medications that may or may not have been needed if it was addressed appropriately maybe 10 years ago. So it kind of plays into the whole thing of us talking that we need to...
Just keep going.
You can't see me.
Just adding around.
That they can't identify. We're trying to get Dhana in, so if there was some technical difficulty there, I apologize. Basically, getting down to the real theme of proper tools, proper diagnosis, and treatment for that patient. So that's be a good example. So we're not going to talk politics. We could talk about Michigan football, but there's not a big reason to. And Michigan State obviously doing well in the NCAA with the tournament. So we're trying to get Dhana on. Hopefully we're not ruining this too much. But getting into the first question, it says, Dr. Pierce, you always talk about how all providers and services are not created equal. That matters where and who you go to for treatments. How do you choose where and who to send your patients to, from surgery to physical therapy? So the big thing is that I'm not knocking, like when I was early on in my career, I wasn't as astute as I am now. But, 20 years of experience gets you into working with protocols. Therapists that I use all know my protocols. And again, I've said this multiple times. It's not like it's only my protocols that work and the other ones don't. It's when everybody's on the same page doing the same thing with the same mission and philosophy, you get much better results. And it's proven out over the years that's been a gold standard of ours. So one, we pick physical therapy with like-minded understanding of that philosophy. As far as from surgery or referrals, I try to match personalities with the actual patient, with certain doctors. There are certain doctors that are great with not so much of a bedside, but technically they're good. All the people I refer to, I'm confident in sending members of my family, and we've done that. So she wants to do something here.
I should try it again.
So we're trying to get Dhana on, and we don't have a big producing show, so we're trying to figure it out from here. So right now, the simple answer is it's people that have similar philosophies, that understand that, it's just not cutting, it's just not narcotics, it's just not, a simple answer. It's a holistic approach. It's taking on multiple things. Like I had a patient yesterday where I was very encouraged to see that she was referred to an acupuncturist early on. And alternative treatment because she had a history of cardiac issues at a young age, so she couldn't go with traditional medicine. So in that case, it was very encouraging that there is other doctors, and actually he was a cardiologist to do that, which is rare to see in a cardiac world. we're hearing about holistic doctors. Again, we're not about, here's the medication, here you go, go about your way, we'll see you in 4 to 6 weeks, or even 2 months. We're someone who is aggressively seeing you right away. Let's raise it up. So hopefully that adds to the where and who. When we talk about where, a lot of it's going to be in the Southwest, Southeast Michigan area. Do we have people outside? Do we have people in Grand Rapids? Do we have people in Monroe? Do we have people in Grand Blanc? Yeah, we do. But a lot of times I make people travel to a good therapist. Like to say, like I hear a lot, well, there's a therapy place on the street corner where I'm at. And I'll hear the name, or I'll just, I won't like it, I won't approve it, I'll be very politically correct and professional. But sometimes driving 15 to 20 minutes for a better therapist is definitely what we need to do. So we're having difficulty. We may not have Dhana here today. So what are we looking to do? It says add it.
I know, just connect.
Okay. Well, maybe we'll bring her in.
You could do like a speakerphone. Just might not be able
All
to
right,
see her.
so to keep going here, what? We're trying to figure out how to get around. I'm sorry, this is really holding us up, but overall, it's where. It says fail. Where we do it is mostly in the areas. We try to get people near their homes. It's not like we have 1 or 2 places. We have multiple places in multiple cities around Detroit and around our Troy office and our Livonia office. And now with us expanding to Shelby, we have partners out there, and then also with Wyandotte, we've expanded a large group of Detroit, Southeast Michigan, so we're able to get those things taken care of. So getting into the questions here.
On a speakerphone on your phone.
Huh?
Call her on your phone. Just won't be able to see her.
Well, that's not good.
We can hear her.
All right.
Or you can FaceTime her, and I can hold it up.
Okay, so we're really going dead here. So we're trying to get Dhana on FaceTime because we cannot get her in here. This is going to be really weird. Can you hear me?
Hi, Dr. Pierce. Yeah.
Hi, there's Dhana.
Technical difficulties.
So we're into technical difficulties. So I don't know how I'm going to do this.
Do you
So
want me to
there,
hold it?
there she is on my chest. Bring her close to my heart. So we're gonna improvise because this is, like we said, low budget telemedicine, everything right now. How you doing?
I'm doing good. How about yourself?
Crazy. We gotta do this right. You gotta get your butt in here so we can get you on. So for those who can hear, hopefully we're hearing, and I'll show her once in a while. But basically, why Dhana? Dhana's, she won't scream about her credentials, but she's probably one of the most educated people in what I love is OMPT, or with manual therapy. She's one of the trainers at Oakland University. So she's not just living it, she's teaching it, and we won't tell how many years of experience we both have, but we've been doing this together for over 20 years. And neither one of us look that old, so you can see from her. But yeah, but the thing is, we've gotten both of us who are well trained, we've seen a lot of experience, and there's not much the two of us have been stumped by. Between the two of us, we can pretty much figure out, what's going on. When's the last time you saw something you haven't seen in a while?
Oh goodness. Well, you do have a good job of sending me some interesting patients. I think everybody
Challenging.
Everybody has a body, and they all have the same bones and same muscles. So we have work with everybody to figure things out.
Yeah. So, I don't know what I want to do here. If I want to go ahead and get in like this or not. But basically, the first question they're talking about, so we, I talked a little bit about the radio show. Can they hear?
Yes.
You think?
Yeah, just hold it.
All right.
Want me to
So-
hold it?
Yeah.
You just won't be able to see her.
Yeah, but. Oh, jeez.
There she is.
All right, so this is, you go hold that for.
Mhm.
All right, so we're going to pull this off somehow. So basically, we got together 20 years ago at the training room over in Troy, which is one of our big locations. We've dealt with professional athletes and everybody from, entertainers, everything. And we had to deal with the highest level. And we really had the philosophy that we didn't treat anybody differently, no matter what their profession was or what they were doing. It's just was sometimes when we had sports agents and lawyers and coaches, and it was just a little bit more pressure on us to get them back on the ice, mostly with the Red Wings type of things. But for the most part, we've treated, I can't even think of how many people together. Thousands? Hundreds? Huh?
For sure, for as long as we've been working.
Yeah, so a lot. So we actually put together the radio show. So Dana's not just here by accident. I have a lot of faith in her and a lot of confidence in her that even if I can't figure it out, she'll put her 2 cents in and tell me I'm right or wrong. Most of the time she calls when she's right. But for our first question, do you specialize in anything specific, rehabilitation or injury type? So basically, she doesn't like my patients because they're more difficult, but most of the time they're spine and back and neck injuries. But you can go ahead and answer that question.
Yes, so specialty. The specialty would be in manual and sports physical therapy and getting people back to what they want to do from where they're at and making goals realistic and perspective for what the patient is actually looking to do. So from working from professional athletes and everyday athletes to college athletes and just people who want to be able to walk again, I think we both share the philosophy we consider everybody kind of an everyday athlete and everybody's treated the same. So specializations would be more or less in helping a patient achieve their goals, whether it's moving to high-level sports such as playing hockey or, hey, I want to be able to walk up and down a grocery store aisle. We can achieve that. We can help the patient achieve their goals.
So moving to question 2, it says, are your approaches of treatment techniques different from other physical therapists, and how so?
I think what we're doing here is at OMPT is we do a realistic approach. Again, we're looking at the patient as a whole. We're not using gimmicks and machines and things and promising things that aren't going to happen. So treatment techniques are mostly manual. We'll use occasional electrical stim, ice and heat to help the patient get better, but actually looking at what the movement pattern is that they want to accomplish and how pain is affecting it. How can we affect their pain? How can we change their movement pattern? Let's say somebody's having pain every time they golf. Let's take a look at what they're doing in their swing and what's causing their pain in everyday life. Take those factors out of the way and see if we can get them back to golf, if that makes any sense.
Yeah, so that's really what we talked about last week, is that at Michigan Sports and Spine, we try to take it to the next level. So a lot of times I've thrown out the term cookbook therapy. So that's exactly what Dana is not talking about. It's about evaluating what the thing is from a functional medicine standpoint. Functional therapy, that's a big term right now, is functional movements. And that's what she's referring to, is that we don't just take you as a static picture. You're moving it dynamically through life. And if it's a sport, we have to deal with sport athletes that, yeah, I can pick up my kids and I can do this, but when I play this sport or I swing, I have this terrible pain and it's hindering me. So you have to go to someone that's at the next level, and that's exactly what she's talking about, is that you need someone who has that expertise to take it to the next level. And Dana does that, and she doesn't even realize it. So there's a big difference between the type of therapist she is and some of the other, what I say, not as well trained therapists out there. So there's a major difference. And the reason I push for a manually trained therapist like Dana is because you only get so many therapy visits. Insurance is dictating a lot of what we do, and we don't have the unlimited amount of therapy. So we have to attack it quickly within those first 2 weeks and actually get on an appropriate plan that will carry out where you only may have 10 to 12 visits. So it's huge that you're going to someone that is skilled as people like us. Would you agree?
We both work on the premise too, is that education is a huge part in this, and people are afraid of their bodies, and they're afraid of pain, and they're afraid of things that they don't know. And I know you know this, and you teach your patients what's going on. So that's a huge process. And hey, look at this is nothing for you to be afraid of. This is what's going on. Look at, we can provoke your pain, we can alleviate pain, and this is how we're going to get you to the next level to where you need to be.
Right. I mean, education's huge. Like what I've always said, even if it's an early injury, we love early injuries because it's easier, but we can also create a whole prevention and education. And the other thing is we're not the people that are going to sit there and say, yeah, come to us, we're going to make you 100%. I'll be honest with you. You come in here with a 10-year history of a pain, I'm not going to pull, it's not like we pull a thorn out of your leg and you're all better. So we're getting refill. So
it's on her end.
It's
the echo.
More technical difficulty. So yeah, there is a huge difference. There's a huge difference in the training. So the next question is, last week Dr. Pierce talked about monitoring your progress with physical therapy. As a physical therapist, how do you monitor your patient's progress outside of the standard assessments you fill out weekly? So basically, how do you know when someone's not progressing correctly?
So every day the patient comes in and they'll spend time with me, not with anybody else, and then I'm going to be asking them the questions of, okay, this is what we did last time. How have you changed things? How have you come along? What has worked for you? What hasn't worked for you? If somebody has a pain pattern, this might hit like somebody lifts their arm forward every time they have pain. If there's something I can do to change that, I'm going to go ahead and do that, and I'm going to measure before and after every single session. So we're following through. As patients improve, we're following through, okay, now what can you, now that you don't have pain raising your arm, but you're weak up there, okay, so let's address that. The next time they come, hey, has that improved anything, or do we need to change our approach? So it's not the same thing ever coming in doing the exact same thing. We're progressing patients, we're spending time with them, we're trying to figure them out, because again, they do have limited visits, and they actually have a little time to accomplish big things that they want to at this point in the insurance industry and in their rehab protocols.
Yeah, I mean, how much have we changed our approaches because of insurance? And we're not saying insurance is right. It's just we're under so much more scrutiny, and we would love, like I always use the example of an anterior cruciate ligament, the big ligament for the knee, and you get 12 sessions. Where that's easily documented, that's a 4 to 6 month rehab program or a shoulder reconstruction. I mean, there's just, there's the therapy's not matching what's really needed. So we need to figure out shortcuts. But more importantly, the quicker we educate you, the more you become an active participant in your rehab program, the better. The days of being dependent on a therapist 3 times a week is gone. Everybody in our grouping, they're on a home exercise program from the day I meet them. And if they're not doing it, then it's talked about commitment. And then some of them we may, even not throw out, but encourage that, hey, you're not ready for our rehab program at this point. So moving into the next question, we're actually moving along here. So question for both of us, what's the typical rehab program or protocol for mild but ongoing low back pain when surgery has been ruled out? Is it worth it? So basically, I'll let you start it, but basically we're talking about a patient that doesn't need surgery. I have my protocols, and you're well aware of my protocols, what I like to do when it's not a surgical case, which, by the way, is probably 95% of the issues. We just lost her.
She's still here.
I'm here.
So we're going to hear her for a second without seeing her. So yeah, so 90% of the issues are non-surgical. So this is a very common way. She's on my stick now. Oh my God, this is the funniest.
You see her?
Sure enough, you would be the one where I've been wanting to get you on, and we have the most technical difficulty. This is like comical. We can get comical on this.
I think that's me. It happens everywhere I go.
This is the bloopers of Michigan Sports and Spine. Top 10 things that went right. All right, anyhow, back to the question.
Okay, so non-surgical low back pain. It's very common nowadays, everybody has access to a gym. Everybody has a lot of information given by a lot of different people, including physicians, physical therapists, trainers, friends at the gym, people who are watching them say, why don't you try this? So people come in with a lot of questions, which I completely encourage, and I love questions. Basically, you're setting them into a core exercise program, and you explain what does core mean, and what are the muscles involved with this, and how do they work, and how does that work to protect my low back? So we're giving them the specifics of, hey, this is what we're doing, and this is why we're doing it, and then we're going to put them in their exercise program, put them in the functional positions like standing, doing their weightlifting, doing their squats, and have them learn how to control and how to use those muscles so that they don't jeopardize or endanger their back anymore. If we put them into the function that they want to do. In addition to that, obviously everybody hears stretching. Well, everybody doesn't have to stretch, but certain people have to stretch certain muscle groups more than others, and it's important to because they use them more. When you use a muscle group, you're going to have some sort of stretching protocol with it because whenever you use it, you shorten it, gets tight quicker. So we kind of teach people, hey, look, these are the warning signs of the muscle groups that you might have to stretch, and we teach them how to monitor them. So we're giving them a core basic program, we're advancing it to their function, and we're giving them a customized stretching program just for them and the things to look out for in the future with their activities that they choose to do.
Yeah, so this is really a long question. We could talk on this question alone for an hour. But, I mean, just to highlight, yeah, you'll hear me, it's like stretching functional movement is key. You don't want to strengthen an already injured area or a shortened muscle. You're just going to escalate the problem. So you have to have functional movement. And like Dhana says, sometimes you find a patient, like I had one the other day, where she can touch her toes, but she's got terrible back pain. So flexibility wasn't her issue, it was more stability. So there's also, you have to worry about the stability and the strength of the lumbar spine, if we're talking about low back, but any type of parts of your body, it's a lot of stability. Like everybody knows about core of your low back, there's core of every part of your body. When we talk about shoulders, hips, knees, there's core muscle groups that are necessary for that. So that's a little snippet, but we could probably talk all day on that. But we don't have time. So question 2 for us, fellow patient here, what do you guys do when a patient just isn't buying into or making an effort with physical therapy? So I'll answer, I usually throw them out of the practice. No, I'm kidding. I don't encourage it. It's not like we're one-dimensional. It's not like, okay, and sometimes those people are more drug-seeking. I don't want to accuse you of being drug-seeking, whoever this person is. But if you're not buying in, there's reasons. So 9 times out of 10, you got to have a therapist that understands what they're doing. And I may need to switch you to a different therapist, or I need to take a step back, and maybe I need to do a reevaluation to make sure we're doing the right thing. If you're just someone who's lazy and I'd rather take a pill and I'll just deal with it tomorrow, then that's a whole different mindset we got to deal with, which really isn't the philosophy for either one of us to treat a patient. You have to buy in. There's value of time, there's value of money, there's value of insurance, and we don't have an abundance of it at this point, especially with COVID going on. But what do you do to motivate them? Do you put on different outfits or something for them?
Yeah, that's a good question. Yes, I can if I need to. My shoes will match my shirt. However, I do find that if I can tell people and I learn about them and I discuss what's going on with you, what is it that you want to do, and why can't you? And then when I can start to change their pain and I can alleviate their pain, I can say, okay, I want you to try this. If you show them that you can help them a little bit, 1%, 2%, they start to buy in more and more. So it's more about spending time with them and listening to them. And listen, it's not a cookbook. You can't do cookbook with advanced low back patients. You can do it with young people who are maybe 20 years old because they're going to get better anyways. But people who are more experienced and have older tissues that aren't as pliable, aren't as flexible, when they'll start to buy in, as soon as they start to see changes and that they see that you're listening and you care about them.
Yeah, I mean, that is a great point. I mean, it is the confidence building and improving it. Like we've had plenty of patients. I'm like, oh, I went to this therapist, it never worked. And I'm like, well, it's different. Like they'll describe, I'm like, well, that's not exactly what we do. And then within a week or two, they're like, yeah, you're right. This is the best therapy. Like one of my patients he owns a big company. He's pretty well to do. He was like, Pierce, your place doesn't look, it's not a Rolls Royce, but you guys treat like Rolls Royce. I thought that was like the greatest compliment. Because we're a boutique. We're not about the marble countertops and the fancy pictures up on the wall. It's more of the bread and butter of getting you better. So, hats off to him to say that. I think he actually put it down in writing to be funny. So, the next question. Is it true that physical therapy can actually improve my immune system, and how? So we're putting on a blog, I think it's going out today, to actually address that, physical therapy and how it actually changes your internals for health and building an immune system. But do you have a quicker answer or another?
Well, the way that I'm thinking directly, that physical therapy without extending outside the boundaries of nutrition and that kind of stuff, and doing some type of not medication, but natural anti-inflammatories would be more or less like we do exercise and we do raise enkephalins and endorphins in those bodies, natural pain-killing chemicals that they use, and those are proven in research to be released when you do exercise and you do strength training, that kinds of stuff, and actually even warm-ups and that kind of thing. So I think that's mostly directly that I could answer that question. However, I'm an advocate for all fields that come in to help a patient get better. Whether it's dietary, cardiovascular, all of that should be included in everybody's lifestyle, especially if you're in physical therapy and you want to improve your well-being.
Yeah, I mean, if you're injured, it does compromise the whole system as a whole. If you take a holistic approach, if you have a back pain or you have pain, the endorphins, everything else is working at a different level. If you're stressed, the cortisol levels go up. So all that, if we can reduce that, create a healthier atmosphere for you, create a healthier environment, and that you're more pain-free, it will relieve stress. I mean, there's so many direct and indirect things for your immune system, and we've evaluated immune systems to the nth degree now with COVID, and we play a major role. I think if anything out of COVID, people are going to understand to respect their body a lot more and get the healing process going quicker instead of, I'll wait till tomorrow type of thing. So yeah, I mean, being as healthy as can be, being in the best shape you can be, and if you do have an injury, taking care of it quickly, not letting it linger because it does wear you down. It wears you down emotionally, which will put you at a loss, and sleep-wake cycles can be messed up. So there's a whole cascade of stuff going on that can compromise your immune system. So the quicker you get treated and get a treatment program, get the right people that have the tools to treat is really what your goal should be no matter what. So this last question, it's too many. It's like, everyone loves a good success story. Can you share, obviously not using names, a great experience the patients had through your care? I mean, we've had too many to speak of. I think the classic is, at least when we're working together, she politely says, I send her my hardest cases. I truly send her my hardest cases, or my friends that are more difficult. But to be honest, when we say we have over an 80% success rate, I mean, we're not lying. We work hard. The difference between the two of us is that we take pride in what we do. It's not like, another person. It's a challenge to us. For both of us, we feel like that patient that's not getting better elsewhere, that motivates us. It doesn't say like, some doctors like, well, you went to this other doctor, you're going to get better. You're not going to, they will give the crazy factor, they'll give other factors. With us, we find it as a challenge. So there's too many people. I mean, nobody comes, God, we're talking about professional hockey players that you've seen play. We've dealt with, guys that told careers were gone, years ago. We dealt with the Red Wings that way. People that know me personally will know who I'm talking about. But even, like Darren McCarty, I mean, he's, we can easily say his name because, we're in his book of recovery. So probably Darren is the easiest, most notable person that we've talked about when he made his comeback to go back on to win the Stanley Cup with the Red Wings when he took a year off. So, that comes to mind real quick. But we're running out of time. Do you have anybody real quick you can think of? I can't mention my other buddy.
You said many wonderful people. here, and I come out on my daily practice, so many wonderful people, and if I can't help somebody with their success, it personally affects me. So every person here is a success story. Hopefully they go out of here successful and they've learned stuff, they've done better.
All right. Well,
I'm gonna.
Huh?
You're the rock, Doc.
Yeah. We've got plenty of those guys that keep going, right?
Yeah.
I mean, we've had some exciting backstage stuff too. We've talked about. We've had people threaten not to go on until Dhana has touched them, and then we've had people that I need that therapist at backstage when I'm done because I won't be able to walk because they wore a weird outfit or something. But we can't talk about that one either. So we have a lot of stories that maybe when you're together with us, we'll do a sit-down session other than publicly here. But I wanted to just mention, we started that giveaway thing of the mask for people that were sharing our program. And Ronnie and Michael S. were our first winners for the first week. So I really appreciate you guys sharing our program, sharing the questions, and spreading the word. Because for us, it's getting motivated. I'm trying to get Dhana and I maybe talking about getting something similar to the radio show we were doing on a weekly basis. Because one, I think we do provide a lot of good information. If you believe that's true, then encourage us. Let us know what's going on. And then, again, thank you to Ronnie and Michael S., big fans of the show or the weekly, whatever we do. But in summary, not all service providers are the same. It does matter where you go and where you're being treated and who's treating. So hopefully we've proven that today. We have protocols in place. Again, Dhana knows my protocols. I don't know if she has different protocols with different doctors or she stole all my protocols and shared it with the other doctors. But, I feel very successful, and this isn't something I started 20 years ago and we haven't changed. It's always evolving. It's always moving. And the biggest message is both of us treat everybody as an individual. There's no cookbook therapy. Everybody, Dhana mentioned it, that everybody's body is different, and it needs to be addressed that way. I love just sitting sometimes at a restaurant looking at people walking by. I just can't believe how many different sizes and shapes come out, and everybody's reacting differently, even in the office. Like when I'm training, I know you train a lot of therapists, you have to look at every individual individualized. So, and not everybody's going to be the same, but we have big education to kind of understand the subtle differences. Physical activity is huge for prevention. We brought that out. I think it's you can pretty much Google anything or see any Instagram. It's all about immune systems and boosting the immune systems and trying to be preventative. It's not, in our world, it's not just 6 feet distance, a mask, and washing your hands. It's all the other stuff that plays a role. And right now, with it kicking up, I think it's more important, and hopefully the good out of COVID will come, that people will be more self-aware of their body and what they need to do to keep the infrastructure of their body and their foundation stronger. Again, we're doing another giveaway this week with masks and hand sanitizers so we can be COVID responsible. And that's about it. Following up, I really appreciate you being on. We're going to do this again because this thing goes smooth as we want. Maybe we'll get you in studio. We may, starting in January, we may come to your place and do a show there.
Whatever's easiest, that'd be great. And I thank you for having me. And I encourage everybody out there to please ask questions of your physician and your physical therapist. Nothing should be off limits. Get your answers so that there's no fear based in your program.
So the quote of the week: the work you do today determines where you will be tomorrow. So again, it's never too late to start. All right? So love you. Peace out. We'll talk to you in 1 week. Have a great day.
Thank you.